Yeah. So I think we're okay to begin. Let's wait. If people join, then we'll let them join the conversation. Um, so we have today Dr. Natasha Pérez Vale. Um, I'm gonna read your bio a little bit so people know you, and then you can introduce yourself. She's a clinical psychology, and she obtained her degree in Ponce Health Sciences University of Puerto Rico, and did a postdoctoral fellowship in primary care psychology at Salud Family Health Centers. Her clinical work has focused on health psychology and primary care, where she has worked with the general population. She has experience with rural populations, focusing on increasing accessibility and tackling mental health stigma. Her work has aimed to promote management and compliance of different medical conditions and encourage health prevention and provide holistic care to the Latinx population as part of this multidisciplinary integrated team. So today we have her, Natasha, and we're happy to have her here, Dr. Perez Vale, and we will be talking a little bit about her experience in a rural clinic and establishing behavioral health or doing behavioral health in a rural clinic. So I'll let you introduce yourself, tell us a little bit about you, and lead the conversation.
Of course, thank you, Aglaudi. Well, I'm very excited to be here. Especially of course because it's SLP and it's very special to me, this group and everything that you do. I know sometimes it's kind of difficult for me to join in the meetings because of the time difference, but I'm always excited to see what the great work that you're doing and the great conversation. So it's a pleasure and thank you for having me. So yeah, to tell you a little bit about me, I mean, I think you said a lot, but so I'm from Puerto Rico, which now that I was hearing, like, when you hear those bios, you're like, oh wow, I have been kind of different places or doing different things. So I think it's kind of crazy for me or my experience, since I'm from Puerto Rico and I've been moving in the last years, which I've never thought that I was going to do. I've always thought that I was gonna, I I'm from my island and I study here, so I'm gonna serve my people. So I've never imagined that I would actually leave the island and like it, basically, most of all. So like you mentioned, I've worked in different health settings. But my latest work, I worked in a rural area for a primary care clinic in the southwest region of Minnesota, which from where I grew up is very, very, very different. Um, it was a very different experience of what I've known or yes, of what I grew up. Um, so I'm excited. I'm excited to talk about it, to talk about experience, challenges, and hear about everyone if what they want to share of experiences or any questions.
Sorry, it takes some time to kind of unmute. Uh, so yeah, I think and if you can answer this question, just for the purpose of the discussion, what are some of your identities that you think took were important to consider in that process of working in a rural, clinic and all that?
Mm-hmm. Um, so so for me, it was very just making the decision when I was looking for a job. For me, it was kind of nerve-wracking. I think also because of the moment that we were living, um, and especially the the state being where was the death of George Floyd. So I remember just making the decision out there. It was a lot of fear, because everything that we were seeing, we are still seeing, of course. Um, my fear was what am what am I cannot even like maybe go down the street or like just that fear for my physical, just thinking about, for example, my physical, I carry a big afro in my head and the color of my skin. And I remember just thinking, what is going to be that experience for me over there? Because where I come from, they're always telling us we're all the same. And for years, just listening that we're all the same, like physically, because we come from the same mix. So I always, when I was making the decision, I thought, okay, this is going to be a big difference for me. So I think that physical aspect, and then the aspect of, for example, having an accent or my culture, my experiences, it was at that moment just a very big difference. So that's something that when I made the decision, I carry it with me, knowing that those were going to be challenges for me, and carrying it with big fear too, which I worked a lot. And once I was there, things changed for me, but I still remember having that, which I think that, you know, it we're gonna carry it wherever we go.
Great. So we talk about rural clinics. Um, what is a rural clinic for you, right? In that place that you were going to, how did that look like? The clinic
Yes,
that or the work that you were gonna do there?
that's a great question, because I remember, like I was mentioning before, so I did the postdoc in Longmont, and I remember thinking that that was rural for me. That was when we talked about um, the work that we do over there. So when I went to this new clinic, I thought it was gonna be similar, but it was even more and more. Like, I didn't thought about the layers maybe of rural. And in this case, so not only the rural part, but the small towns was very new for me. In this case, it was 10,000 of population. Um, and I think, like, again, coming from where I come from, I think that we have small towns, but those were very, very small towns where everyone know each other from years and years. They know, your family, who you are. So coming as a new person in that town was a very big deal, which I didn't understand that. I remember even like in interviews or before, people were like, but are you sure? Have you like seen where are you moving? There was a lot of questioning too of why would I make that decision. Um, which at first was very interesting to me, like why everyone is making me almost question the decision. Um, and then when I got there, I understood the culture um, of the small town, of how, the part of the community are protecting themselves, of, having maybe that and at the end I saw it more of a curiosity of them. There was a lot of curiosity of why I moved there, or where I come from, purpose. A lot of questions that I received through my time that I was there. So now for me, I kind of, there's more, not only the geographical part, or the population, but also was farmers, a lot of farming around those small towns, and that has to do a lot with, their lives. And so it was a matter of understanding that their whole culture.
Do you guys have any questions for Dr. Perez?
Hello, everybody. I'm very curious about any recommendations, Natasha, that you have if anybody is considering working on a rural area, which I have to say that I know that it's also different from frontier places, but um, I think that you mentioned a couple of things about people knowing everybody, And I wonder, if somebody decides to work in those rural areas, which mental health services, behavioral health services is so much needed, what will you recommend?
Yes, I would say first, having a good research of the area, for different purposes, for personal aspect, but also, like you mentioned, there's such a great necessity in having resources and accessibility. So knowing also those resources of mental health, of when you are with the patient and you're going to need some resources that maybe are not available, where you can go, and maybe having like a binder, or having like a, not maybe a specific binder, but having a good resource and preparing yourself for those challenges that we know that we're gonna have. Well, the rural areas have. So having a good research of those areas, what could be helpful, and getting to know as much as you can, if the person is not there, of the counties, of everything that exists, and being very familiar, resources, but also community, what is important to the people in that community, because I think that it could be difficult. There's so many, when there's gonna be so many things to adjust, that I think that if we can prepare ourselves with that from the beginning, that's going to be very helpful.
I'm also very curious about the differences between the Latino population that you were working with north of Denver versus what do you see, or what do you think that are the differences? I don't know, maybe challenges or other struggles or other things that, in general, differences between those populations in two different areas in the States.
Yes. That's a great question, because I think that I went there with that idea. Again, I think that same dicho of we're all the same. So I think I went with the same idea. And it was very different in the sense. Well, first of all, of course, how do you say, there's so few, there's very scarce the activities or resources that they have for the Latino community, so you don't see them as a lot. I remember like people telling me like, well, there's not a lot, but then I could hear people talking in Spanish, and I remember the first time that I heard someone talking in Spanish, like my head, I was like a little girl just like seeing and just like in shock. So I think that was a big difference. In it's not that there were few, it's just that you didn't, maybe they want to like resources or opportunities for them to build their community as well, I think. And for example, North and Colorado, there were more of an established, and I mean, you guys can talk more than that, from your experience than me, but as how I saw it, it was that it was more established, where they places that they could go and gather. Here, you didn't see them like more out there. So that was one. There was just, I think I saw just like one in the time that I was there, well, maybe like one or two like activities and for them, and yeah, and so they were always looking for more things like to be, for them. Also, something that I've noted, and I mean, maybe there as well, but the kids in school, the struggle with how it was very, even like same school, it was not same school, I'm sorry, like the staff, the kids, it was very difficult for them, just to understand certain things, or everyone that it was different. So I've seen more of the struggling kids at school. And again, a lot of necessity in having spaces for them, which I think that in Colorado, I could have seen more of that. And it was kind of more, I had, I think, more resources to give and kind of more hope, I think. Instead here, I felt more with, arms crossed.
Okay, so there were Latinx population, but you didn't see them as a community as we have them here. You don't know, maybe specific places that are meant to serve that population.
Yes. And very few that I knew had like their own. They gathered, for example, but it was very that others didn't know, others Latinos that came new to the town, they didn't know. So even there were sometimes if I found something or resource, they didn't know. So there wasn't like a maybe like more specific place that they could go to the few things that they would have. They didn't have any maybe how to access it.
Right. I have more questions, but I want to know again if the group wants to ask something.
One more.
No, continue.
I'm very curious about, because the role of the clinic that you were working at, or the organization on building that community or on helping that community. I wonder if there were any efforts on that aspect, or if the clinic was in the process of realizing the role at a community health center. I hope that my question is making sense, right? It's like
No, it is.
Clinic
I don't know
had
if I have the answer, but yes.
Yes, if the clinic had any awareness about their role on supporting or even creating those communities for this population, Latina population, to feel safer in the town. I wonder about that when you were talking a little bit about them not having that awareness of other Latina being there.
Yeah, I mean they definitely were aware, but I think being, and again I'm speaking here from my experience, not from another point, but I think the having that how do you say that, not availability of maybe like providers or people, because even in the mall, in the other areas, it was very scarce. Like for example with interpreters, it was difficult because of the area, I'm assuming, to have people that, or even more, and then they have in the area of the staff you can see that diversity, but specific projects or programs, I'm thinking if I think that I know of, there wasn't like a big one or something specific, but I know that, for example, like something that I think that it was great that they have was they have how do you call it, community health workers in Spanish speakers, and that was a great resource. And I remember, so for me, something that it was very great, and unfortunately it was at the end because my job, I'm no longer work there, but at the end I got to, for example, collaborate with that community health worker, and talk about exactly the challenges that we were talking about the schools. And there were some ideas to, for example, to work with the school. So I think they kind of, it could be slowly, but they were aware, and were trying to consider it as well.
Do you think then that there was a big need for the population, even though they didn't have the resources? Because just to make it clear.
Yeah, I mean, in comparison with maybe how many people, maybe it doesn't seem like a big need, but I would say it is a big need because of the necessities.
Okay.
In numbers, it may not seem, but yeah, it is.
Okay.
It is, and I think we can always do more.
Anyone else? So I kind of have a follow-up question, right? Because at the beginning we talked about all of the considerations that we made or we make, right, when moving to a new place, our fears, the research that we do, how do we prepare for it? Do you think the place where you went, right, as I don't want to say an outsider, right? Because, but it is a community that is very tight, right?
Yeah, it was.
So you might come as someone new, and then with your differences, maybe also from people who live there. Do you think that they were ready, or did they consider the challenges that they would have, or that you would have? Not challenges that you would or they would have, but the things to consider, to have someone new, someone different, someone in our space, and how to make it work and make them feel how they, everyone else,
I can definitely say that they did, because so how for example, and I've been really blessed. Every place that I did my postdoc, or in this place, I had a great team. And in this case, the team they were very, even before I got there, they were considering and having space in their meetings for me of how they could help me in getting appointed too, because they knew that it was a big difference for me. So they did, even though they were, for example, they weren't in the same town as me, they were like an hour away. They did like meetings, like physical meeting in person. So that was something that I really appreciate. And also, they would have like, I would say like bi-weekly meetings with me too, to see how was I adapting to the area, and that I was taking care like of my personal life as well. Not taking care, but that I was that area was also like covered, that everything was well. So, and they always had like suggestions. They always made sure that I was supported. And I could have those conversations with them too. So yeah, I don't know if that was a question, but I did feel supported in that way.
Yeah, was someone muted? No, I kind of saw something while I looked down, but maybe not. If anyone has questions, just unmute yourself or write them on the chat, or just share them. That would be nice. I do have another question, thinking about diversity, right? Sometimes we know and notice that there's a need in a place to serve certain communities that are underserved. But there's a fear, right? There's no one else like me there. What would you tell someone that's in that situation, or considering going to a place where there's no diversity, and I call it diversifying, with the interest or the value of, I want to then go and diversify the team, right? I want to do that then. Do you think it was worth it? What would you tell someone that's thinking about going and doing that and maybe has fear about it?
Yeah, I do think it was worth it. I mean, I know it was difficult, it was difficult, but it was worth it because I think it helped me a lot even though, like you mentioned, with the fear that I have at first of, I know people are not going to look like me. I know people are not going to have the same experience as me. Maybe I won't have someone to talk even, Spanish with. But I try to find similarities in their experience. Instead of, there were a lot of moments where I could choose like to be frustrated and maybe mad and angry and not understanding, but I chose to, or it helped me to see similarities and seeing it with curiosity, like and maybe in an empathetic way too. Like I know I think where I'm from, someone in my town comes from another country and is a psychologist, is a therapist, probably I'm going to ask the same questions as well. So I always try to ground myself on, what's their experience, seeing it as curiosity and taking the good. I think I didn't, that I remember, I didn't have like bad experiences. So that helped me a lot. So I would say to take it of course, maybe it's not for everyone. So do the research first and know about where the area and also have a purpose, right? In this case, I really liked what they were doing, what they were needing. The purpose of me being there, and that helped me a lot. Of me having, it wasn't just a job. It wasn't like, well, yeah, because if it's just a job, then I wouldn't have moving there. So having a purpose was very important for me because it helped me in every challenge. It helped me like refocus. And that helped me through the all the experience. Every time that I felt, because as we know, implementing integration, it's difficult. And even more so for example, in that area, they were very accustomed of the traditional model. So it was very difficult, the education part, because I felt that I needed to re-educate every time. And sometimes I got frustrated with that because I thought that I was being clear, but it wasn't me. There were so many different aspects. There are so many different aspects and cultural and how, the model for many years, how they've been working. In that area, I think, and I talked a lot about that with looking for, how do you say, consultation, for example, on how they saw, how do you say, how they don't want to bother, maybe they don't want to bother you. So, and we know that in IVH, we need to bother everyone. And that's something, that it's gonna be important, and not bothering, right? Because it's not bothering, but having that that attitude of being there, every time. How can I be of service? What can I do? How can I help? So that was a big thing for me too, as well. Like learning that maybe it's not me, it's just another thing that I need to get out of the way. I need to stop questioning and just like seeing the purpose. So, and I know that we know that our service brings big benefits. So every time communicating the purpose and those benefits. So that's something that it helped me a lot, and I think through the whole experience, seeing that purpose.
Definitely. I think connecting, especially when we're going to do something that's hard or difficult, connecting with those values and having a reason, and like you said, a purpose and why we're doing this, definitely an important thing to overcome and work with the challenges, because we know why we're doing it, and it has meaning. Great. I was going to ask you a question. Let me know if it's too intrusive. But I was gonna say, like, how do you balance, because we know, right, we have our identities, right, and I have my own, right, I'm a Latina, I'm a woman, queer, Black, right? And I also go to a place, and it's hard sometimes not to think that the resistance or the challenges I'm facing have to do something with those identities too, or might, right? How did you balance that and in between not taking it personally, right? But also recognizing it's normal because it's a change, right? But
Yes.
then I don't know if it's a comment, it could be a question. You can answer
No,
Or
no,
taking it
expand.
personally too.
it's a great question.
Yeah.
Mhm.
Were you gonna say something, Dr. Kendall?
Or taking it personally too, right? Because
True.
Yes,
sometimes
Mm-hmm. Mm-hmm.
yes. It is a great question because it's so difficult. I don't know if this happens to you guys, but when you are like in the middle of, I can go with this and just like blow this, or or I can do this other thing and the proper way and whatever, or how to balance it. So I think it depends on the position or the stage maybe, because we know in integration there's so many different stages, and that's something that I had to work with. I wanted to see integration the next day, so I had to work with having patience and seeing in different stages. So for me, I remember some specific situations where I couldn't pinpoint, maybe if it was like you mentioning the identities, or maybe the another identity, being a psychologist, being in mental health in primary care. So again, I think going to the purpose, going again to the purpose of what I wanted to create there, and then that was kind of that was very important to maintain that flow, and not what we worked on for not to dissolve it. So going back to that purpose helped me a lot. I'm trying to remember, there was a specific situation now that you were describing it that I felt, I don't remember, but I remember that I try always to go to that purpose and seeing even more. And of course, if we have to be clear and stand our grounds and our boundaries, that's going to be important too. So making that balance of establishing maybe those boundaries or something that maybe we have to say or be vocal, but not letting that purpose go of integration or what we want to do in that moment. And I think it's for me, it's horrible because I'm not a confrontation person. So for me, I'm dying inside, but I know that it's gonna be important to say something or to establish, those boundaries or whatever it is that I need to do.
I'm gonna let Dr. Oken follow up on that because that was a question inspired on her.
um no, I don't. I think for the person um with different identities, it's a big challenge to always separate what is going on, right? I was hired here to implement some changes. What are the resistance that I'm going to confront? It's the natural aspects of the job that changes are always challenging, or are pieces of my identities that plays a role, right? Biases around my gender, the way that I look, things like that, right? And I think that it's important to talk more about this because we do come we enter to rooms with everything that we have on ourselves, right? And I think that thinking about it from the leader perspective, from the supervisor perspective, from the manager perspective, from the team leader, it helps a lot to also be able to support others and be very intentional on the openness to talk about it and see how those human interactions in the clinic gets better, regardless why the resistance, right? So those are my 2 cents.
Yeah. Like you said, it's not gonna be easy, but it's important to still manage the anxiety that comes with it and the discomfort
Mm-hmm.
to have those conversations.
Yes,
Great.
and especially because I'm sorry, but especially because it's probably gonna return. You're probably gonna have more other interactions like that. Um, so establishing those grounds or those boundaries or whatever it needs to be said, it's gonna be important because if not, then it's gonna return, and then probably it's gonna be even more difficult to manage. So maybe even though I'm dying and fearing how to say something, but at least I'm working it now versus for it to be even more difficult in the end.
But it's a learned skill, right? It's that.
No, I'm saying it now like it's easy.
That's
Con
what,
la
what I
boca
was
un
gonna say.
mame, but no, it's not easy. Takes time.
Hmm. Yeah, that was my next comment too, that it's not something you're gonna be able to do right away, right? It's something that you need to practice, and with practice, you're gonna get
Yes.
better at it.
Yes, and the first time, well, for me, my voice trembles, and then the second time, it's always practicing and practicing more until it's more kind of more natural. But I think, and now it's very interesting. Now that we're talking about it, it's more powerful when we have people, when we're talking about it and we have different ideas and we feel supported. Versus not having that support and feeling like you're the one that is in the wrong and you're the one that maybe is rude. Maybe not. They probably they're gonna just put you a stamp that you're rude. And so yeah, definitely I think Dr. Oquendo mentioned or you mentioned something that we need to continue to talk about and empower each other.
So having people, right, to talk about this, discuss this with someone, maybe a mentor, maybe consultant, I don't know, maybe a colleague, that shares a little bit of that. It's important in the process, definitely.
Which I think it's also a challenge in a rural community, right?
Yep.
Where are you going to find those people?
Yeah, I think you would have to reconnect with maybe people from other experiences,
With
right?
us. Serving Latina populations.
Exactly, with us. Exactly. This is a space for that actually too, right? To bring up those challenges and receive feedback about those.
Yes, and that's what I did. I mean, Dr. Oquendo has always been a great support for me. And even if I wasn't like talking to her, I could hear her. I could hear like, I know what Oquendo would say. I know what Oquendo. So having, even though if I didn't have it in a moment, the training was a very important part of what we do. So that's good of being an early career psychologist, that you have that fresh.
Any questions from you guys? Any comments?
Hi, everybody. I'm coming late to the conversation. I'm Susie, and calling in from Philadelphia. Jefferson, I'm not going to be at the conference, but I've been to the conference. I think I went in 2010. I'm now a BHC for about 14 years. And I just feel like I need to vent about the challenges that I sometimes have. Is that okay?
Sure, yeah.
Okay, so I cover a few different offices. I go to one practice and then I cover a few different offices. And one of the practices I cover is for patients who are like uninsured and underinsured. And sometimes they're Spanish speaking patients, sometimes they're Brazilian. And I feel so helpless. I literally just got off the phone with a Spanish speaking patient or Portuguese speaking patient. And there's such a lack of resources around here that I'm aware of for this community. Now, this woman wants help with changing her medication. I don't know one Portuguese speaking psychiatrist. I just sometimes feel really helpless. So I send people some resources. If they can access it through their portal, it's great. But I don't know if you come across this. I've come up with some resources for and I speak some Spanish and I feel connected to the Hispanic community. I have a Mexican spouse and I'm often the person that people send people to, but I feel like I don't have a lot to offer for certain things. And so I literally am just getting off of a call with somebody and I felt helpless. And I wish I had more resources, therapists to offer people who could help, with these populations. It feels like there's just more obstacles and it's challenging. So I just felt like I needed to share that. And I've been wanting to come to this small group and get some support around this. Yeah.
Great. I'm glad you made it. What you're saying, it's pretty much the challenges that a lot of people are confronting. I wonder if there will be some people in your area that you can also connect via CFHA that can also help you navigate some of those resources, because I think that's the other challenge. It's, yes, lack of resources, but then when there are some resources, so it's difficult to access them because we don't know about those.
Yeah.
So I wonder if that could be helpful. We have Basecamp, and feel free to put there in the chat where you're at, and what we can do to help you, to support you. Maybe there are good ideas from other members in the group that can help you there. That's another way also to vent, not only in our monthly meetings, but also in Basecamp. And I'm pretty sure that we can come up with something there.
Okay, thank you. Yeah, I could certainly send a message to this group. I'm on my small personal phone right now with you all, so I'm
Sure.
not going to do that. But in maybe one of the invites, I can message back and just ask for some support that way, because it can feel lonely. Like I had this was a phone call with an interpreter, and then I'm like the only BHC for this primary care office within the hospital system, and I don't know many other people who I work with who have Portuguese speaking patients and Spanish. So it can feel isolating.
Mm-hmm.
Yeah.
Mm-hmm. I think that's the topic, right? Today, working in rural areas where there are not a lot of resources. And I think that at the end, it's a lot of creativity, honestly, to be able to find ways to work with patient population that are in need.
Thank you.
We're definitely more than a therapist. Sometimes we have to, and that's something from Dr. Oquendo, have different hats. And that's something that sometimes we start maybe saying like, no, I'm going to focus on this because I want to focus on my job, but to treat the whole person, we definitely, and specifically more in those rural areas, work in different areas as well.
I'm in Philly. This is not a rural area. It's just it's a city, and still there's obstacles to get people connected. I've actually reached out to a couple therapists who advertise on Psychology Today that they speak Portuguese, but they're like, we don't take new patients, or we only accept insurance. So then it's like, okay, or so it's just, I can only imagine what it's like for the patient, like another closed door, another, and the accessing can be really challenging. So yeah, thank you.
Yes, definitely access. It's a big thing, and I think that is why it's so valuable when we are integrated in healthcare system, because sometimes we are the only people that they will have access for many, many years until being able to connect them. So I think that bridging care, it's another important factor for this population, that at least we can work with them for a couple of minutes, I don't know, monthly or every other week, to making sure that the patient is stable enough, include medical providers, include, whoever we can include in the clinic, care managers, for the patient not to feel alone, even though that what they need is actual treatment and sometimes medications, right? So I think that using different team members helps for the patient to literally survive until we're able to take care of the actual need, and contacting also responsible people who, if the patient is on Medicaid, or it gets more complicated when, of course, the patient is uninsured, which is another big topic right now with the enrollment process in Medicaid, and a lot of people not having access to that.
So we're almost, well, we're 10 minutes from ending our conversation. I just wanted to know if there's any final thoughts about what we talked about: challenges, being creative, how to overcome them, and search for that support, using CFHA and these groups on Basecamp to connect and maybe reach other people that might be able to help. Any final thoughts, Dr. Perez?
I think you summarized it really, really well. Just working on, like you mentioned, having that creativity. For me, something that helped me too is that, and I don't know if I mentioned this, I came with some boundaries and how I want them to call me this way. I won't do this, I won't do that. And then seeing the necessities that came down. So always maintaining that assessment of the needs. And like you mentioned, we've mentioned being creative on not losing that focus on providing excellent patient care, or also the mission that you have if it's implementing the model. So yeah, working a lot in the personal aspect as well, because it's going to be difficult to provide a great service if personal it's falling apart. So working a lot on our process of acculturation and adjustment. I think that's going to be very important as well. And yeah, I think also, I mean, we talked about this, and when we talk about integration of having that ongoing communication with, for example, the providers, but I think with Spanish speaking patients, it's going to be very extra important to increase maybe that communication with the providers, and making sure that both parts are and understanding the message. That's something that helped a lot too. And also not, I think, very important in integration, not only the providers or nursing, but it helped me a lot, for example, to work with scheduling. That was a big important part, and with Spanish speakers too, because sometimes there wasn't like an interpreter like at the moment very quick, then that's something that another had that maybe I could help. So yeah, I think working on those aspects of the personal aspect, creativity, verifying those boundaries, and what else we can do besides just the therapist role, because we're treating the whole person, and that is much more than just us in the therapy room.
I agree. I think it's something that helps me a lot, or have helped me in this type of setting, and the things that we do, is that recognize our limitations, and that there are things that need to change from a systemic point of view, and recognizing that we're working on it. We're
Mhm.
not just there yet, but
Yep, that is true.
good. Any other comments from the group? Any final comments?
Important. We're getting together the CFHA conference. We're going to be around. And we will send you messages about our meeting time.
Yes, I still don't have that, but we're working on it, and we will be communicating with you guys about the time that and place and date that we will be meeting. So join us if you can.
And if not, if you cannot make it to the conference, we will be in base camp. And monthly here. Of course, we're not having the next meeting next month because we're going to do conference. But we will be sending you also the next meeting dates.
Yeah. Can we, it would be to base camp, right? If they have any recommendations or topics, could they send that to base camp as well?
Yes, yes, we will be able to
Okay.
see them.
Yeah, so if you feel like you want to share something or there's something that you would like talk about or let us know, and we'll happy to get those suggestions. So I want to thank Dr. Natasha Pérez Vale for joining us today and having this conversation with us. And thank you for your openness. I know and the feedback that you gave and the recommendations and sharing your experience. I think it's always good to. Sorry, I was reading the chat. Hannah says that she's gonna add everyone here to Basecamp. So if you're not in it, you're gonna get in it. So yeah, so I appreciate it. I think it's very valuable to all of us to remind ourselves that we're not alone, that there are people out there going through similar experiences. But like you said, what we do is important, and we're connecting with our values, and we're doing it for a reason, right? And that keeps us motivated.
Well, thank you for having me, and thank you for having this conversation. I think it's something, I don't think it's a topic that we talk enough, specifically to the Latino and Spanish speaker in Hispanic. And it's very important because, like you mentioned, it's very isolating, and it's an ongoing conversation too. Because again, we're just looking what it works, what helps. So it's an ongoing conversation that it would be great to continue to have this conversation and help and the great necessity that it has. So if we can have more VHPs in rural areas, it would be great to continue talking about this.
Yeah. Anything else, Dr. Oquendo? Yeah.
There will be some unicorns at the CFHA
Oh yeah.
conference in one of the presentations. Look at the program, check for unicorns. You will see.
Yeah. Good. So we're done. I hope you all have a good rest of your day. Thank you for joining. Keep an eye out for the other invitations and other meetings. We'll be happy to have you. Have a good day.
Thank you.
Thank you. Bye-bye.